What are mood disorders, and does having ADHD make you more likely to have one? Hi, I'm Dr. Roberto Olivardia, a psychologist at Harvard Medical School, and today I'm going to be answering the internet's biggest questions on ADHD and mental health. Is there a link between ADHD and mood disorders? Yes, mood disorders are characterized by depression as well as bipolar spectrum disorders. Symptoms can include feelings of sadness, agitation, irritability, feelings of worthlessness, trouble with sleeping and eating, having difficulty enjoying things that you normally would enjoy, and in some cases, suicidal ideation. About 20% of people with ADHD struggle with a mood disorder. There are a lot of specific ADHD risk factors that can predispose someone to a mood disorder. First, neurobiologically, we know that the ADHD brain sometimes can take a little bit more time to find a reward, or what we call that dopamine pathway. This can lend itself sometimes to mood instability. We know that people with ADHD are more prone to emotional dysregulation to begin with, so that can be a slippery slope when it comes to something like depression. Also, struggling with ADHD could bring up a lot of stress for somebody through executive functioning issues, problems with sleep, with jobs, with relationships. ADHD affects every life domain, so it's not a surprise that ADHD would be a high risk factor for developing depression. The key, though, is once we understand this relationship and this connection, it can inform treatment interventions to make sure that we're adequately treating the mood disorder and the ADHD. Many times in clinical settings, the mood disorder is diagnosed and the ADHD is not. And even at times when the ADHD is diagnosed, it's often not clinically appreciated in the same way as the mood disorder, when we know from clinical experience you have to treat both the ADHD and the mood disorder. Does ADHD increase the risk of mental health disorders? ADHD rarely travels alone. About 80% of people with ADHD will have a mental health disorder or a learning difference. What do I mean by mental health disorder? Things like depression, anxiety, substance abuse disorder, or an eating disorder. Most people with ADHD will have 2 to 3 associated mental health conditions. And this is super important to know in terms of how ADHD can impact every aspect of life, that it's not a surprise that we would see these disorders in their wake. The neurochemistry of the ADHD brain, things like emotional regulation issues, impulse control, affect one's social life, occupational life, relationships, all of which then can be quite stressful for the person with ADHD. This is why education is so important, because then the person with ADHD can advocate for themselves in terms of getting the medical help and the treatment that they need and that they deserve. These things don't have to cause as much havoc if we get the proper treatment. Is there a connection between ADHD and OCD? Yes, so first, OCD stands for Obsessive Compulsive Disorder. It's a psychiatric condition characterized by intrusive thoughts or imagery, and often a person engaging in compulsive behaviors to neutralize that thought. It's a very, very difficult condition. Now, at first set, people might think that ADHD and OCD are almost opposite disorders, but surprisingly, we see them together more commonly than people would think. Studies show that about 30% of people with OCD also have ADHD. Now, in some ways, you can think of OCD as also being an attention dysregulation condition. For example, for someone with ADHD, that could look like a student in a biology class that might be a little bit bored and is looking out the window and not really paying attention because what's out the window is a lot more interesting and stimulating. For the person with OCD, being in that same biology class, learning about cancer might stimulate a threat value, intrusive thought that, oh my gosh, someone in my family is going to get cancer unless I pray 15 times. We often can see both of these conditions, and it can be confusing to sometimes untangle what's the ADHD and what's the OCD. Therefore, it requires real careful diagnosis and treatment to make sure that we're adequately treating both conditions. And by the way, if you haven't explored our channel yet, we have a lot more content on ADHD. We have topics like ADHD and anxiety, how to improve focus, and a lot more. Is ADHD linked to personality disorders? First, a personality disorder can be a complicated thing to define, but I'll try my best here. Basically, a personality disorder is someone who lacks a very solid sense of identity, of who they are. Sometimes they can see themselves and the people or the world around them as being all good or all bad, and not really much in between. Symptoms of borderline personality disorder, for example, can include emotional dysregulation and impulsivity. Sound familiar? People with BPD often have real difficulty in maintaining healthy relationships because of that idealized, devalued way that they see themselves and other people. This is very different than what we would inherently see for people with ADHD. Also, a major difference is ADHD, we know, is fairly heritable and neurobiological in nature. And although there are certainly biological aspects to borderline personality disorder, we know that a lot of the aspects of the diagnosis come from the environmental impact, histories of trauma, emotionally invalidating environments, which some people with ADHD experience. So it's no wonder that we see in studies about 20 to 40% of people with borderline personality disorder also have ADHD. And the biggest takeaway is awareness. When we understand the relationship and the connection between these disorders, then it drives treatment to make sure that we're getting the treatment that we need in order to adequately address all of the conditions that are on the table. What's the deal with ADHD and skin picking? Well, skin picking, along with nail biting, nose picking, cheek biting, hair pulling, are collectively known as the body-focused repetitive behaviors, or BFRBs. It's a mouthful. Having ADHD absolutely places someone at higher risk for BFRBs. Now, it's not really a surprise as to why. BFRBs are associated with individuals who seek those behaviors to achieve self-soothing, grounding. Sometimes people engage in those behaviors mindlessly, as almost a fidget, whether they're playing with their hair and then it might result in pulling their hair, or picking at their cuticles, or biting their nails, all of which affect people with ADHD. Studies have also shown that these behaviors can also create a dopamine response in the brain. And we know how the ADHD brain craves that dopamine. There are many successful strategies and mindful strategies that can help people with these conditions so that they don't have to get in your way. Does ADHD medication change your personality? Great question. For those of you who are first trying medication, or for parents who have children who are taking medication, this is something we get a lot of questions about, and understandably so. It's a big decision. The truth is that medication can be very helpful in the treatment of ADHD, but it may take different medication trials. It may take multiple medications, trying different doses, and that is a bit of a patient process for someone to go through. However, when somebody is on a successful medication trial, not only does it change your personality, but it will change it for the better. If anything, we want someone's personality to be enhanced, where now they can execute all of the things that they had difficulty doing before. It does not dull one's creativity or dull their spark. When the medication is working the way you need it to, it's removing the obstacles that are getting in the way for someone with ADHD to move through the world. Things like poor executive functioning, emotional dysregulation, sleep problems. ADHD medication helps with all of those so that someone could live their fullest life. Have any questions we didn't answer? Try asking the Understood Assistant, a free chat tool on understood.org. It'll give you quick answers and customized tips based on expert vetted resources. Thanks for watching, and make sure to subscribe for more content like this.